So we have long heard that there is a big difference between eating breakfast in the morning versus not eating breakfast for weight loss. We have long been told, and we probably counseled patients on this, that that statistically speaking, eating breakfast in the morning, those patients have lower weight overall and less weight gain long term. Well, new research came out from the British Medical Journal that totally contradicts this and calls this long assumption into question. And so this study it was a meta-analysis of several different studies that have been done over the past several years, but there were some limitations. The average follow-up for weight loss and looking at long-term effects of eating breakfast versus not was only 7 weeks, which, as you know, for weight loss isn't that much, and there's only an average of 2 weeks follow-up for looking at how this affects total day energy intake. So this one I really love because for patients, it's really important to think about how can they lose weight and how can we prevent and reverse chronic diseases. So I want to talk a little bit about myself for a second because I think it's important to articulate that, yes, while I'm a medical student, weight loss and counseling patients is actually something that I've done for a long time. So I am a certified personal trainer, and for several years I worked in a gym where I helped patients lose weight. Now, I considered them clients, and we did a lot of exercise, but the majority of my counseling was done through dietary and nutrition intervention. I have 2 master's degrees in nutrition and metabolism, and those have taught me that there is a big difference between practical weight loss for patients and what the actual science shows. So I think right now we're under a clear issue where for most of my clients that I used to work with, for many of them that actually were consuming too many calories and struggling with losing weight, I would recommend skipping breakfast because it was just one less meal that they weren't eating. And so their caloric intake was dropping, which is something that this study actually did show and agree with. And so from a practical standpoint, it was really important to reduce the amount of calorie consumption to help long-term weight loss. But I want to counter this with what the actual science about when is it best to eat. Because we're not taught nutrition in medical school. Most of the physicians that are watching this, you probably never learned anything about nutrition. And this is one of my expertise. This is my area that I love. And so I want to talk about the science of nutrition and when is it actual optimal to eat. I'm not saying optimal for a weight loss perspective, but the actual science of what is happening in the physical human body. And so this brings me to a topic called circadian misalignment. So circadian misalignment is when you consume your calories or your sleep schedule is thrown off based off of what time you're sleeping, based off of the light or the blue light that we typically see outside that is regulated by the suprachiasmatic nucleus. So the SCN is crucial in regulating sleep and homeostasis and wakefulness throughout the day. Eating later in the day actually shows clearly that it affects our sleep cycles, it creates circadian misalignment, and it alters our ability to drop our cortisol levels when we sleep because naturally when you eat, it increases your cortisol levels pretty high. This circadian misalignment actually, there was a good study that showed that eating after 9:30 p.m., I know for you shift workers this doesn't really count and this is going to be hard for you, but eating after 9:30 p.m. increased your risk of breast cancer by 1.48 with an odds ratio and increased the risk of prostate cancer by 2.2. So that's not an increase of 2%. That's the odds ratio increase of 2.2. And so for every 10% increase in calories consumed late at night, it actually accounts for about 11% increase in your CRP, which, as you know, is an inflammatory C-reactive protein, which is crucial for regulating a lot of the body. So why is circadian misalignment having these different effects on the body? Well, circadian rhythm actually regulates a host of different hormones that circulate throughout the day. And most of these you know, which are cortisol, testosterone. It regulates your insulin, your blood sugar, body temperature, carbohydrate oxidation, beta oxidation. And these changes and fluctuations based off of your circadian rhythm actually affects gene expression. And so why are these cancer rates higher? Well, DNA repair mechanisms and cell division actually are regulated by two different proteins, PER1 and timeless, that are altered based off your circadian rhythm. Circadian misalignment alters those regulation of those proteins. It also regulates cell cycle regulators, namely WEE1, MYC, and cyclin D, which I'm sure all of you can remember from your biochemistry courses, are crucial in preventing cancer and also pro-cancerous genes. And so I think it's important to remember that although we may not recommend breakfast, we have to consider that if we're not recommending breakfast, most of our patients may push their eating window later in the day and maybe even into the night, creating that circadian misalignment and really fundamentally changing how their body is metabolizing food. I know popular bro science tells you that a calorie is a calorie and it doesn't matter what time you eat, but it's actually not necessarily accurate. And that's because the circadian regulation of these gene pathways also does two other things. And that is that in the morning, you have two different things. You have an increase in your testosterone spike and your cortisol, but you also have the highest rate of diet-induced thermogenesis, which is the breakdown of your food. And so carbohydrate metabolism and fat metabolism from a gene expression level is actually highest in the morning. So that is why most, if you look at dietary recommendations, recommend that for breakfast you should have a carbohydrate-rich meal or a fat-rich meal, whether it's some fruit for the carbohydrates or some oatmeal, or maybe you're going for more of a high-fat avocado toast type of meal. Where if you look towards the evening, how that circadian rhythm affects gene expression, you actually get an increase in your gluconeogenesis, you get an increase in glycogenolysis, growth hormones, and protein synthesis. You know that for athletes, sleeping is one of the crucial areas for rest and recovery, and that is because that protein synthesis and that protein regeneration is actually optimized at night. That is why consuming more protein at night is actually better for rest and repair long term, because those genes are upregulated to deal with that amount of food intake that's being taken in. And so there are several setbacks that patients need to be concerned about if they're shifting their eating window to a little later period. And that is that fasting for more than 14 hours can increase your risk of gallstones. For type 2 diabetic patients, by skipping breakfast, you may actually go hypoglycemic if you continue to take your medications in the morning. For those who have familial hypercholesterolemia, you're at an increased risk of diabetes, obesity, and spontaneous atherosclerosis while under a fasting protocol. And for those who are obese, you may see, and you fast, you may actually see a slight increase in total LDL, HDL, and your CRP levels, which I think are really important. And last but not least, I know this has been a long one on diet and breakfast. I want to talk about the microbiome because that's actually where my PhD research is that I'm doing it in. And that is, a second ago I said that people should eat their carbohydrates in the morning. Well, high fiber in the morning, as you know, fiber is breaking down by the bacteria in your stomach, which generate short-chain fatty acids, propionate, acetate, butyrate, some of the popular ones that we've heard in the media. Butyrate actually increases the production of the neuroendocrine hormones PYY and GLP-1. Now, both of these are taken up by the blood, and they suppress ghrelin and appetite, which regulate blood glucose, insulin, your HB1, body weight, and body lipids. So by increasing your carbohydrate intake in the morning, you are increasing your body's ability to suppress your appetite throughout the day. Now, obviously, this may not be practical to patients, and I know that the science is not clear right now what's best to recommend to patients for weight loss, but the science shows for longevity purposes, for most of the health benefits, increasing your consumption of food earlier in the day and front-loading it, and then not eating later at night may be better. So for these and all the links that we discussed today, I want you guys to make sure you check out Medscape. You can check us out on medscape.com, also Twitter, Instagram. I want to thank you for joining us today on the Weekly Dose. We will be here every week, and we will cover the top 3 topics that are trending on social media. With that, thank you guys, and I hope you enjoyed this episode. Make sure to leave feedback and ask any questions that you have in the comments. With that, this is Frank Cusimano, and I'm signing off. Thanks, guys.